everyone, so I'm here to show you the Ohio CNA Skill for female peri-care. First, you want to start with hand hygiene. You're going to rub your hands with hand sanitizer until dry. Next, you're going to knock and introduce yourself and explain the procedure. Hi, Mrs. Smith. My name is Davina. I'll be your CNA today. We're going to be doing peri-care. Next, you're going to put down the side rail. The bed is already at a comfortable working height, which is mid-thigh to waist. The resident is already in supine position. You want to make sure that you gather your equipment. You're going to need a bath basin filled with warm water. You want the temperature to be 105 to 110 degrees, and you can check that with your wrist or elbow. You're going to need 6 washcloths, a pair of gloves, a barrier, and a bath blanket. You want to make sure that you have provided privacy by closing the curtain, and you also want to make sure that the side rail is raised on the opposite side of the bed, or that you have the test observer stand there. Okay, let's get started. Mrs. Smith, I'm going to place your call light over here to the side. We're going to go ahead and lower that side rail. I'm going to take the bath blanket and I'm going to lay this across the resident. Remember, you are not allowed to shake the linen at any time. Next, I'm going to reach underneath this bath blanket and I'm going to lower the blanket. And you do this, it's very easy. You just pull across. You just got to make sure that you don't expose the resident at the same time. But you just fan fold it down in small sections. Now I'm going to put on my gloves. Next, we're going to expose the resident only the part of the body that we will be cleaning, which will be the perineum. The next step is to place the barrier underneath the resident. And you can have your resident turn to their side, or you can have them thrust up. I'm going to ask Mrs. Smith to thrust up. Mrs. Smith, are you able to thrust up? Okay. We're going to go ahead and bend the knees. Okay, Mrs. Smith, on the count of 3. 1, 2, and 3. You just want to glide that barrier underneath. Return the legs into a comfortable position. And then go ahead and cover those back up with the blanket. With your first washcloth, you want to fold that in half and then fold that in half again. You're going to have one corner that has 4 loose corners, and these are the corners that you will be applying the soap to. First, you need to put it in the bath basin, wring out any excess water. Go ahead and get your soap. Locate those 4 corners and apply the soap to each one. You're going to rub the washcloth together to create a lather. When you are cleaning the perineum, you need to make sure that you separate the labia, and you want to start at the top, and with each stroke of the washcloth, in one single stroke, you're going to go from top to bottom past the rectum. Use your thumb to separate clean and dirty with your washcloth. Here we go. We're separating the labia. We're starting at the top. One single stroke past the rectum. That's the first side of the labia. Now you're going to move on to the other side. Same technique. Top all the way down past the rectum. Separating the labia. Now you're going to clean at the top of the vagina, going all the way down past the rectum. Last fold, same thing. Separating the labia, top all the way down past the rectum. Discard. You're going to put this in the designated container. Your second washcloth will be for rinse. Again, locate those 4 loose corners. Separating the labia all the way down past the rectum. Moving on to this side. Same technique, top to bottom, past the rectum. Now you're going to clean the vagina going all the way past the rectum. Last fold, same technique, all the way past the rectum. Discard. 4 loose corners. This time will be pat drying. Start at the top, all the way down past the rectum. Now you have 2 more folds left. Same thing, top to bottom. And as you can tell, I am pat drying. Discard. And now we're going to turn our resident to their side so we can clean the back side. You want to cover the resident back up on the front side. We do not want them to be exposed when we turn them. Make sure you take their arm and place it into a position so they are not turned over onto their arm. We're going to take this arm here and we're going to place that across their chest. Bend the knee. Mrs. Smith, on the count of 3, we're going to turn you onto your left side. 1, 2, and 3. Be very careful with the turn. Keep an eye on their head, their arm, and again, making sure that their front is covered. You should be only exposing the body part that you are cleaning. Now we're going to clean the backside. First, washcloth. You want to wring out any excess water. Apply the soap to the 4 loose corners. Rub together to form that lather. And when you're cleaning the rectum, you need to start at the base of the vagina. Single strokes, fanning outward. Base of the vagina. Base of the vagina. One last fold. Base of the vagina, fanning outward. Discard. Second washcloth is for rinse. Wring out the excess water. Find your 4 loose corners. Same technique. Base of the vagina, fanning out. Base of the vagina, fanning out. And one last base of the vagina, fanning out. Discard. Now we're going to pat dry. One last fold. Pat dry. This is a good time to remove the barrier. So go ahead and fold that. You're going to tuck that underneath the resident. Okay, Mrs. Smith, we're going to have you turn back over onto your back on the count of 3. 1, 2, and 3. Go ahead and return their legs into a comfortable position. Same thing with the arm. Go ahead and cover that back up. Now we're going to remove the bath blanket without exposing our resident. Okay. You're going to take your bath blanket and you're going to place that in the designated container. Don't forget to remove the barrier that we have folded over to the side. This will go into the trash. Next, go ahead and put that side rail up. You want to lower the bed into the lowest position. You want to raise the head of the bed just a little bit, semi-Fowlers. You're going to open back up the curtain. You're going to take the equipment and you're going to return those into the designated containers. This wash basin will need to be emptied, rinsed, dried, and returned to storage. You're going to give Mrs. Smith back the call light. Here you go, Mrs. Smith. You're going to remove your gloves, discard your gloves, and then for this skill, you will need to do hand washing with soap and water. And remember, if you do not wash your hands with soap and water, you will fail this skill.